Okay, this video is called The Best Cardiologist, okay? So I'm talking to this internist friend and some other doctor buddies, and the internist says to me, you know, I had a patient, just got a cardiac calcium CT at some other hospital. He's got a lot of calcium in his coronaries. You know, he's got a normal EKG, no symptoms. So I told him I drew some blood to check his lipids, but I told him he should be on a low-fat vegan diet, so he doesn't get symptomatic coronary artery disease. That the calcifications themselves don't necessarily change things that much. They're an indicator of risk. So why are you telling me this? Internist, well, if he had angina, I would have sent him for a treadmill stress test, standard management. And Dr. McDougall calls a treadmill stress test a conveyor belt to go to the cath lab for a cardiac cath and then the operating room. Internist, yeah, pretty much. He said, when I try to teach patients about low-fat vegan diet, they don't even want to listen to me. When I talk to them about drugs and surgery, stents, they pay close attention. The patient said he's going to go find the best cardiologist. He has a friend who knows who the best cardiologist is, and that what I'm thinking is he doesn't understand. This guy is going to end up getting stents or surgery. And I said, I know. Patients have everything backwards. They think stents and surgery are real medicine, real science. They love the high-tech stuff. The fancier the thing, the better they think it is. Robotic surgery, all this bullshit. And even though it doesn't work well, they don't know. But they think diet's a joke. Internists, I know. I can't get them to care about diet. I don't know what to say to them to get them to care about diet. And I'm like, well, you could tell them about epidemiology. The incidence of coronary artery disease in low-fat vegans or plant-based diets that are almost entirely vegan, like 90-95% vegan. It's like 0%. They don't get coronary artery disease. They don't get hypertension. They don't get diabetes. They don't have obesity. It's obvious. Okay, it's like 100 to 0. None of them have it. Whereas where they're eating the standard American diet, the vast majority of middle-aged and older people, they're hypertensive, diabetic, pre-diabetic, diabetic with coronary artery disease. Almost all of them. The cure rate for low-fat vegan with coronary artery disease is about 100%. The cure rate for stents and cabbage is about 0%. Internists, to us, it's obvious, but patients just don't get it. Even if you tell them about epidemiology, they won't listen to you. Like I know too, I got friends and relatives with graduate degrees, medical degrees, and they're not interested in learning about diet or changing. It's amazing how stupid they are, narrow-minded. And then also, I was telling them, I have a lady, friend of a friend, okay? She's about in her mid-60s, this lady, and she had coronary artery disease, she had angina, she had a heart attack, she's going to some fancy cardiology place. And then she got worse, she needed a pacemaker. And then I was asked to talk to her. And I talked to her, and I'm like, did your doctor recommend low-fat vegan diet? And she's like, no. I said, well, you need to get a new cardiologist. And she said, oh, no. My cardiologist is the best. My cardiologist is the most prestigious cardiologist in the entire city. I said, well, if he doesn't recommend a low-fat vegan diet, then he's either an idiot or a liar. And I said, pretty soon, out of all the patients in the graveyard, you're going to have the best cardiologist. It's stupid. Prestige doesn't mean anything. The question is, does he get the patients to get better? And the only thing that cures coronary artery disease is low-fat vegan diet. You could try all your statins and you can lower your cholesterol with that. There's some benefit to that, but there's a lot of catches to that. They can increase your risk of type 2 diabetes, increase your risk of cognitive decline, muscle pain, weakness, fatigue, etc. Well, all you got to do is go low-fat vegan. You'll have increased energy. It's for free. That's what I would do. Anyways.